Hi everyone, welcome back to my channel Pharma Catalyst. In continuation with the ICH Guidelines Introduction Part 1, I am doing this second video related to the ICH Guidelines Part 2. Let's discuss about the ICH organization members. ICH contains 17 members and 2 standing observers and 32 observers along with 742 experts in 33 working groups. Let's discuss individually. Let us see the 17 who are the 17 members in ICH. ICH, they have again classified these members into 5 types. One is founding regulatory, another one is founding industry, third one is standing regulatory, fourth one is regulatory, and finally it's industry. Let's discuss individually who are all the 17 members. In this founding regulatory, we have European Commission, which is a regulatory body of European Union, and we have PMDA, which is Pharmaceutical Medical Devices Regulatory Agency, Japan. We have USFDA, a US Drug Regulatory Agency, and in founding industry we have EFPIA, which is European Federation of Pharmaceutical Industries and Association. We have JPMA, which is Japanese Pharmaceutical Manufacturers Association. We have PHRMA, which is Pharmaceutical Researchers and Manufacturers of America. And in standing regulatory, we have Swiss Medic, it's Switzerland's medical regulatory agency, and we have Health Canada, it's Canada's regulatory agent authority. And in regulatory, we have ANVISA, which is a National Health Service Surveillance Agency, Brazil. And we have NMPA, which is a National Medical Products Administration, China. And we have HSA, Health Sciences Authority, Singapore. We have MFDS, which is a Ministry of Food and Drug Safety, which is Republic of Korea. We have TFDA, Taiwan Food and Drug Administration, Taiwan. We have TITCK, Turkish Drug and Medical Device Institution. And in industry, we have Bio, and we have Global Self-Care Federation, and we have IGBA, which is International Generic and Biosimilar Medicines Association. They have classified all these 5 types and these members. Let's discuss about 2 standing observers in ICH. We have 2 standing observers in ICH. One is a well-known WHO, World Health Organization, and another one is IFPMA, which is International Federation of Pharmaceutical Manufacturers and Association. Let's move on to the observers. We have 32 observers. These 32 observers are from the regulatory authorities and regional harmonization initiation or international industry or pharmaceutical organizations or international industry and pharmaceutical organizations, or international organizations are regulated by ICH. International organizations are regulated by ICH. These are all 32 observers from the different areas. Let us discuss about ICH working groups. These, as we discussed in the earlier, ICH working groups will be having nearly 742 experts in 32 working groups. These people will act as a founding or standing members, or they act as a members or observers, standing observers and others. Let's come into the main point. We have seen the organization chart of ICH. Let's see about what is ICH guidelines. How many guidelines were there till now? ICH guidelines have classified their guidelines into 4 parts, like quality, safety, efficacy and multidisciplinary guidelines. These ICH guidelines, total of 70 guidelines we have as of November 2020, and we have 24 quality guidelines, and we have 15 safety guidelines, and 21 efficacy guidelines, and 7 multidisciplinary guidelines. And also along with this we have electronic standards for the transfer of regulatory information guideline, CTD and ECTD guidelines, along with it MedDRA guideline. So in the next videos we will be discussing about all the individual guidelines. Let us see how these guidelines are made, what are the steps and protocols involved in the development of these guidelines. This is the process we are discussing, how this ICH guidelines will be started, and it is classified into 5 steps, where in the step 2 we have step 2A and step 2B. In step 1A, the working group members will be giving you the consensus draft of any guideline. Once this draft was there, you in the step 2A we need to get endorsement from the members of ICH assembly. In step 2B, we need to get endorsement from the regulatory members of ICH assembly. In step 3, we need to they will be taking this public consultation by publishing the draft guidelines. And again in the step 4, they will be adopting those guidelines and they will make the final ICH guideline. And step 5 is implementation of these guidelines. Thank you.